Hi there, this is Lori Edge-Hughes and this is your 4-Leg Rehab Minute. And in today's minute, I want to talk about effective mobilization. So this comes up because of some cases that I've seen in my clinic. So I want to talk about this. Okay, first off, massage does not mobilize a joint. Okay, so you need to do more than massage if you're wanting to change the motion or perceived position of a joint. Okay, perceived position. Perceived position. If you know, you know, okay? Because then we can go into that conversation, but that's not this one. All right. Also, grade 1 and grade 2 mobilizations can only help with pain or help decrease inflammation, but do not change motion at the joint or perceived position. Okay, so you got to do more. Sometimes you need to have multiple techniques that you can try to adequately mobilize the joint. And sometimes you need to cycle through those techniques because sometimes the order of the technique makes a difference. You try this and that doesn't work, so you try that, and that doesn't work, so you try this. And then you're like, okay, oh, I forgot, maybe I should do this. Okay, sometimes the order. Sometimes things need the right order. If you envision a joint and how it moves, sometimes it needs to slide this way before you can ask it to slide that way, okay? So sometimes you need multiple techniques in different order than what your standard go-to is. Alrighty, so also then you need to grade the pressure of the techniques and increase that, i.e. you move from a grade 3 to a grade 4 if you're not making a difference. And by not making a difference, I mean if you're not getting things better and you're not making things worse. Okay, so then it's like, okay, maybe I need to push harder. I need to do a grade 4, okay? So you need to know that and be able to grade. And if you're not making things worse, don't be afraid to get to your grade 4 technique, okay? Because what's the consequence is that you don't get things better. Alrighty, so just a tiny bit of a motivation/rant. Okay, that's it. So the message is sometimes you need to increase your pressure. That's it. Until next time, cheers.